in Illinois. We are here today with a very clear message to support aging in our state by investing in caregivers, home-delivered meals, and by preventing fraud. We are wanting you to especially pay attention to Senate Bill 2617, which is sponsored by Senator Lightford, who's with us here today, HB 4014 with Representative Lilly, who is also with us here today, and then a bill to help seniors in terms of bankers and requiring bankers to hold themselves more accountable for not allowing scams within banks, and that's HB 4767. These are not extras that we're talking about. These are all essential infrastructure items that allow for older adults to live in safety with dignity in their own homes. Illinois is aging. Make no mistake, Illinois has had a 37% increase in the number of older adults since 2010, and the further data shows the urgency of this issue. The number of older adults living in poverty has increased 72% since 2010. At the same time, participation in our dining programs is rising sharply as SNAP benefits have been taken away from many people in our state. Householders age 60 and plus using SNAP have increased very dramatically by more than 170% since 2010, and we know that seniors are less likely to apply for SNAP benefits. They feel like somebody else is more deserving from me even when they go hungry. This tells us something important. More older adults are struggling to afford nutrition, even with federal support in some cases. And those who are homebound, they really desperately need home-delivered meals. You're going to hear from my fellow AAA directors in a moment about how great that need is and about how we are now starting to ration meals, and waiting lists have been started in many areas of the state and will soon start in suburban Cook County. Investment in these things matters very much, and with that, I know our legislators need to get off to other business, so I am going to ask Senator Lightford and Representative Lilly to step up. They are both such amazing champions of our work here in this state, and they've been on this track for years now, so thank you.
Thank you. Good morning. I'm State Representative Camille Lilly of the 78th District, and thank you for being here with us today. This is such a critical issue as a caregiver that I am today. Family caregivers are the backbone of the system that cares for our older adults. Every day, they make it possible for older adults to remain in their homes and in their communities where they want to be. Without these caregivers, spouses, adult children, neighbors, and friends, many older adults will face premature installation at significant high cost to the state of Illinois. But caregiving comes at a cost. Many unpaid caregivers are balancing jobs, raising families, and managing their own health, all while providing critical care and support to their loved ones. That's where Illinois Aging Network steps in. Through the tools like T-Care, they don't take one-size-fits-all approach. The AAA assessments each caregiver unique situations to understand a specific source of stress that is being experienced, whether it's emotional strain, financial pressures, or lack of respite. Then they connect caregivers to targeted supports like respite, counseling, training, and other services that help them continue in their role without burnout. This is a smart, cost-effective investment. When we support caregivers, we stabilize the entire care system and help older adults have dignity at home. Increasing funding for caregiver supports and home delivery meals is essential to meeting growing demands and ensuring no one is left behind. Home delivery meals don't just nourish our adults, they support caregivers too. When meals arrive at the door, it's one less task a caregiver would have to provide to that loved one or that client. For many caregivers, especially those struggling or juggling jobs and family responsibility, Meals on Wheels, meals delivered to the home, provides peace of mind. They know that their loved one is receiving the nutritional meal on a regular basis and just really having their basic needs addressed. In many cases, home delivery meals are what makes caregivers sustainable. Without them, the burden increases and the risk of caregiver burnout and more cost rises. When we invest in home delivery meals, we don't just feed older adults, we strengthen the entire caregiver system and help families continue to care for their loved ones. We must continue to invest. We must do more and invest in these services that provide quality life and dignity for all older Americans or Illinoisans. Thank you for your time. We are committed to investing in our older adult. Oh, go ahead. And now we'll have Leader Lightford.
This is my sister in so many ways, and we shared the responsibility of caregiving for our parents. So you did a wonderful job, Camille. Good morning. I am so happy to be here again today. Seems like we were just here a couple weeks ago talking about the importance of caregiving. And one of those items that arose in that discussion is also food disparities for seniors. So I'm happy to come back as the Illinois Senate Majority Leader, Kimberly Lightford, today to stand before you as a daughter who spent a few years caring for my mother. So I know firsthand the care of the aging population and what their needs are. Seniors across the United States are facing food disparities at an unprecedented level, leaving so many people wondering how they can do more with less. Just in our current fiscal year, a little bit over 65,000 Illinoisans have been served through our home-delivered meals, such as Meals on Wheels, and over 10 million meals have been delivered to residents across the state. 10 million meals have been delivered to residents across the state. So it's not that we're not engaged and concerned and working in the space, it's just the demand has increased. Therefore, our support has to increase. So although the program to feed our seniors exists, those most in need are often forced to go without adequate resources. The demand for Meals on Wheels and other programs remain staggeringly high, with over 450,000 seniors in the state facing food insecurities. Our aging population has undergone unique challenges, and now it's time for us, for lawmakers in Illinois, to take a stand. Our older adults and their caregivers need revenue streams that are able to provide the care, the support, and the resources necessary, not only to put food on the table for our seniors, but also to ensure that they can thrive in their day-to-day lives. That means putting an end to food disparities across the state. It means ensuring the full potential of Meals on Wheels is realized in this fiscal year upcoming. It means cracking down on long wait list times that are perpetrating hunger for countless older adults in need. It means tackling caregiver burnout. It exists. Burnout is real for caregivers. Trauma is real for caregivers. And with SNAP benefits on the chopping block for many Illinoisans, especially our seniors, the pressure Meals on Wheels and other services experience will now only worsen. So older adults who are already stretched budgets to thin will be forced to make impossible choices to put food on their table or pay for critical medications. Illinois has a multi-sector plan for aging. We have a vision, but a vision without funding is just a wish. The older adults and caregivers of Illinois deserves more than a wish. They deserve revenue. They deserve revenue streams that not only uplift them and allow them to live their entire life to the fullest, but also a revenue stream that supports their most basic needs, like a warm meal. So let's show them that we mean it. Let's show them that we care. Thank you.
Now, I apologize, but now that you've heard from Leader Lilly and Leader Lightford, we get to hear from Senator Doris Turner. Thank you so much for being with us.
Oh, thank you. Thank you very much for this opportunity to speak just for a couple of minutes on a subject that is near and dear to me. And as I begin to become a senior, it becomes more near and dear every single day, But I do. My name is Senator Doris Turner, and I represent the 48th District in the Illinois State Senate. And I stand in solidarity with Leader Lilly and my colleague, because this is a subject that it affects everybody in a special way. And if it doesn't affect you today, it will affect you tomorrow. That's for sure. And I know that you're going to hear from a number of people talking in very specific terms about dollars and why they're needed and where they go. And I just want to talk for a minute specifically about the Meals on Wheels program. That is a program that is much more than just a hot meal that comes to your door. As Leader Lightford said, food insecurity is a very real thing, and it is becoming more and more populated with our aging citizens. And to have a meal that you know you can count on, a nutritious meal that you know is going to come to your door every day, that takes one less burden off of someone. It takes one less burden off of the individual, as well as one less burden off of the caregiver. And that really means a lot. And keep in mind, these are meals that are coming without any pay. You know, you're not paying for them. They're coming to your door. The other thing is, you know, our seniors sometimes can be very isolated. And when you have someone that you know is coming, that may be the only person that they see. And that's important. It's important for your physical health as well as your mental health. You don't know what may be going on with that person that no one else will have the opportunity to take a look at, or that's another set of eyes that they may have to reach out to someone for them to get extra help. You know, we want our seniors to be able to stay in their homes as long as possible. You hear all the time about how budgets are squeezed, and funding for assisted living and extra caregiving services is almost, you know, out of reach for many. So the opportunity to have a senior remain in their home for as long as possible really takes a burden off of a lot of our economies in a lot of different ways. And in order to prioritize our caregiver services, that starts with increasing funding. You know, and we say that our budget is our moral document on where our priorities are. And I think that there's no better place for our priorities to be than on our seniors that are here with us. Home care is not an easy job. And the people who show up every single day to care for others, I don't believe get enough credit for the hard work that they do, always putting others before themselves. And when we can have that home-delivered meals, the Meals on Wheels, again, that's one less thing that people have to worry about. You heard Senator Lightford talk about the stress and trauma of caregiving. One less thing that they have to worry about. I have, and one of the reasons why I feel so strongly about the Meals on Wheels program is because I have had the opportunity to actually deliver Meals on Wheels a couple of times, and it's you know, it really is something that takes you back, and I think that everyone who's looking at doing these budgets should have the opportunity to do that. When you see people get so excited about just seeing someone at their door, so excited about seeing a meal coming to them, and having the time, you know, and taking time to want to talk to you because that's the only person they see. I had people were calling the office, where's my food, where's my food? It's because people were talking, and I'm like, okay, I'm coming. But yeah, you should really have an opportunity to make that circuit and do Meals on Wheels delivery at least once, and it will really impress upon you the importance of that program. So thank you very much for all of you being here and sharing your stories. Thank you.
Can you repeat that? I just caught the end portion. So what I'll say to that is we haven't given up trying to generate new revenue. We still have about 3 weeks before May 31st, so a lot can happen during that time. Thank you.
Good afternoon. My name is Margaret LaRaviere, Deputy Commissioner of Senior Services and the ED for the AAA for the City of Chicago. It is such an honor to be here with my AAA colleagues and to stand united with our leaders here in Illinois. We greatly appreciate the governor and the state's continued investment in resources like caregiver supports and home-delivered meals. Home-delivered meals, which of course is also known as Meals on Wheels, is more than just a meal, as previously shared. It is a lifeline. It provides opportunities for senior well-being checks. And for those older adults, it may be the only person that individual consistently sees. Just to show share a little bit about what's happening in Chicago. Over the past 3 years, our meal numbers have grown by 300,000 additional meals each year. Last year, Chicago provided 4.7 million meals to thousands of seniors across our community areas, touching every single ward in the city. We are aggressively following strategies to try to fight against the creation of a wait list in Chicago. Given the size and the number of people that we serve, a wait list would basically suspend the program, as we would need to wait for people to get off before people would be able to get on. Our senior population across the state and within the city is growing. Chicago's largest growing senior population is 80 years old and older. And then we have the uniquely challenging situation of seniors experiencing a mortality gap, passing away earlier at the age of 70 on the south and west side of Chicago. And we know that access to quality nutrition, along with chronic disease management, helps to address those gaps. So we are here seeking a larger investment in HDM. We understand the government cannot do it alone. The additional investment will be leveraged with increased public-private partnerships, as mentioned in the multi-sector plan. The Chicago Community Trust recently invested $3 million in HDM for both Chicago and Cook County. We have a partnership we're working with Greater Chicago Food Depository to coordinate meal service delivery for our seniors in CHA. With federal changes present and on the horizon, and our federal dollars constantly being threatened to be withheld, we're certainly at a tipping point, and with our ability to care for our seniors, and it is definitely an all-hands-on-deck approach, very much required and appreciated during these challenging times.
Hi, I'm Becky Salazar from Egyptian Area Agency on Aging. I'm the director there, and we serve the lower 13 counties of Illinois. I don't have too much prepared, just that last year we served 500,000 meals in very rural areas, so that just shows the number of meals and people in need of food and different things, especially with cuts in other areas. Some of our food pantries are lower in food, and some of the SNAP changes. So we're concerned because we do have one county that's had a wait list for the last year, and then we have another county that's about to start one, and we can kind of see the demand for food in all of the counties, and so we are very concerned. And so I appreciate your time today to listen to us.
Hi, everybody. I am Shana Holmes. I'm the CEO from Southeastern Illinois Agency on Aging, and I cover 9 counties in the lower part of rural and remote Illinois. We have very few resources and disparities, but we just keep going because our older adults are needing these meals. Overall, we serve about 250,000 meals every year. So the need is great. I want to give out a great appreciation to the Illinois Department on Aging and to our director, Mary Kelo, and to all of our colleagues here today that are continuing to serve the older adults. And we appreciate your support in the great service that we're doing.
Hello, I'm Carolyn Austin. I'm the CEO for AgeLink. We're the area agency on aging for Lincoln Land, serving kind of south central Illinois. We have a 12-county service area. And just to give some perspective, I wanted to mention that we serve an average number of weekly home delivered meals that totals about 6,700 a week. So we are very appreciative of any funding that will help us to meet that goal and to overcome wait lists. But I also want to introduce one of our home delivered meal heroes, the director of one of our programs, Greater All Nations Tabernacle Home Delivered Meal Program, Sandra Douglas.
Thank you. In March 2022, Greater All Nations Tabernacle Church of God in Christ, we expanded our senior ministry. I had been in the ministry for over 20 years. And this was the most challenging that turned into the most rewarding ministry. We serve about 350 meals per week, and we deliver 2 on Monday, 2 on Wednesday, and 1 on Friday. And it's not a day. I would say like 4 or 5 times a week, somebody will call me and they're so excited about their meal. They'll let me know what they're eating. I just listen. They let me know what they're eating. But the sad part is that they have to stretch their meal. And they become really creative. We have one person, if we have a sandwich, she takes 2 pieces of bread and make it as toast. So it can make you cry. And then I have another person, if I have a sandwich, she takes half the meat off and makes 2 sandwiches. So this is just how important it is for me. And it improves the quality of participation. Just not only that, it's about the nutrition. We have a dietitian that approves all our menus, and it reduces food insecurity. And all things are important because it impacts the whole life, the quality of life. It's extremely important that Meals on Wheels not just providing nutrition for the body, it deters isolation and providing a set of eyes that observes medical and security concerns. It's just, sometimes it's just someone coming to the door, someone smiling. We've had some that come to the doors and it just didn't seem they was quite right. We got on our emergency list. We gave them a call. It's just a part of living. It's wonderful. And the critical part is saving the lives of seniors and so necessary. We don't want our seniors to have to move away from their home. And if they don't have a quality meal, someone's not coming in, someone's not checking with them, that'll happen. And we have assessment. She's the LPN, she goes out, she talks with them, and just, kind of see what the home living is, see if there's something, is there another program that they might need, and then we just take that down, and then we give them a call. The sad part is we have to go back to the office and we have to take a look at our program. We might want to fund them. We might want to put them on as another client, but if we don't have the money, we can't do it. And we don't want to have a wait list. So we do hope that we have extra income that we'll be able to expand our list. Thank you.
Hello, my name is Heather Fontanez. I'm from Area 09. We cover 5 counties. We have Marion, Jefferson, Clay, Fayette, and Effingham. I just wanted to say that I thank you to my colleagues for all that they do. We are out here fighting for our seniors. We definitely need this increase more than ever, and I want to thank Mary Kelo for her consistent fight and continue for us. And like I said, they've said it best, so I won't take any more time from you, and I appreciate everything that you guys have. Thank you.
Thank you.
Good morning. My name is Vanessa Monahan Kepner, and I'm the director for the West Central Illinois area. We serve 6 counties: Adams, Brown, Calhoun, Hancock, Pike, and Schuyler counties. So far, year to date, we have served about 58,000 home-delivered meals. And I know just how important those home-delivered meals are because that's actually how I got my start with my agency. So before I took the director position, before I was the assistant director, I was a home-delivered meal volunteer. So I was able to witness that pleasure of delivering the meals and seeing firsthand how it impacted their lives. So we appreciate your time and thank you for considering the increase in funding home delivered meals. Thank you.
Good morning. My name is Tessa Mahoney and I'm the Executive Director of Age Central. We serve Peoria and the 5 surrounding counties, and just so far this year, we have served 169,000 home delivered meals. One home delivered meal to feed a senior is roughly $7 to $10, and with that cost for a year, we're talking $2,600 to feed a senior or an older adult. Nursing home care is 3 times that, not 4. 4, 5, 6, Mary? Okay, 4? Yeah, about $8,000 a month. Can we agree on that number? Yeah, so quite a bit. So if we look at this from a preventative angle, to serve older adults home-delivered meals is really saving Medicaid dollars, and we can serve an older adult for about $2,600 a year, and we know that 1 month of Medicaid can cost way more than that. So something to keep in mind as we ask for these additional funds, and we're just really grateful for everyone's support and time as we keep fighting this fight. So thank you.
Hi, good morning. I'm Marla Franzak. I'm with Age Guide. We are the area agency for the 8 collar counties outside of suburban Cook County. About 770,000 older adults live in our 8-county region. We go from Wisconsin to Indiana, so we are delivering meals across a wide span. And what we could say is everything that everybody has said here. But I want to just emphasize how much we do leverage at the local level. These are volunteers. Sometimes these volunteers are older than the residents that they are delivering meals to. And the cost of delivering meals is increasing. So gas prices, our volunteers oftentimes just donate that cost back to our programs, but it's getting very expensive for them to be able to do these meals as well. So while we keep talking about demand increasing, the cost of meals is increasing, the food costs and the gas costs. So in order for us just to keep pace, we need additional funding. But again, we are leveraging so much at the local level. Heard from all my colleagues, and we do not want our older adults to have to sacrifice and make 3 meals out of 1 meal. We can do better. So thank you for your support.
So you have heard stories from around the state from most of our area agencies on aging today, and we ask you in all gratefulness to please pass money to increase our home delivered meals allocation by $10 million. That won't even do the whole trick for us. I hate to tell you the total number we really need, but $10 million would help us get a long way throughout the state of Illinois. Thank you to Mary Kelo, the Department on Aging, and to our legislators who have supported us for so long. Have a great rest of the day. Oh, questions. Mary always reminds me, we do. Yeah, great.
The budget request you have is in SB 2617, right? That is a $6 million appropriation.
That's for the caregiver program.
Caregiver program? Okay. How much do you really need then? You said that we really need more than that.
We need $25 million.
And that is for specifically
Home delivered meals. I mean, we have calculated together the need at the current rate of increase with the SNAP benefits decreasing, and the real figure at the bottom of it at the rate that the city of Chicago and suburban Cook are increasing, and just because our numbers are so big, you know, it drives quite a bit. We were delivering in suburban Cook County about 1 million meals a year before the pandemic, and after the pandemic it was closer to 3 million every year, but it's going up every month and every day. So right now we're rationing meals. We're decreasing the number of meals that people get from 7 meals per week to 5 and 4 meals per week, at the same time that some older adults are getting notices that their SNAP benefits are being cut. And so we do have we have testimonials from a couple of those people that we can share with you.
So why aren't you requesting?
We are just being very respectful of the state's budget. You know, we've been trying to listen to the legislators that are our champions, and we don't want to, completely take over, or, we don't want to be so greedy, I guess. We just want to have us get to some of the place. We've been wide open in terms of the need, but legislators have been guiding us in our ask. So this is a level that we think is doable, and we also think that it's going to save the state money. Yes, there's a question at the back.
Yes, I'm Jacqueline Giorgio with the National Association of Black Journalists. We just founded a chapter for Central and Southern Illinois.
Thank you for being here.
No problem. I wanted to know, so you were talking about the need in terms of the participants, the seniors. What about vendors? Are you finding a shortage of vendors pre-pandemic?
Yes, some of the vendors are having a harder and harder time. You see some of the handouts and how high our costs have increased over the years. You know, the per meal cost has just gone way up. Age Options in our area has recently developed a relationship with Patchworks, which is a Black woman-owned not-for-profit that works with us to deliver meals that are based on food that is produced by the Pembroke farmers south of Chicago. So that's one of our newer solutions to partner with them in order to keep up with demand. We are also, I want to introduce Connor, I'm blanking on your last name, and I know you so well. Connor Deloge, yeah, he's with us from Topbox. This has been another very creative solution that we have had. So he is delivering through Topbox meal boxes with menus and curated to a whole range of different populations. We have a Latino box, we have a African American Black food box, we have boxes for several of the other ethnicities. And so I really appreciate, this is a newer partnership that we have where they, please talk to Connor later because he has so many creative ways of procuring food, and I know in metropolitan Chicago we've particularly been able to make use of that particular service. So really appreciate those. Thanks for asking that question, because 2 new creative ways we've had lately.
Can someone speak to what rural counties will be facing if they...
Yeah, sure, absolutely. Who would like to?
Well, I know that we've had a waiting list in Jackson County, and so it's we're looking at the prioritization, looking at other states, and it's very difficult, I think, for deciding who wouldn't get a meal. I mean, nobody should not get a meal, and so it's a struggle. We've looked at things locally too with the farmers and food works and different things, and so I'd be interested in talking to the top box, but I think we are going to have to start thinking outside the box to try to get more people with meals. And we, like I said, we have other counties too, and it's the cost of delivery. So a lot of them are doing 5 meals at once, 1 hot, 4 frozen, just to save on costs. And you know, we're trying everything we can to try to keep as many people with meals and costs down.
Will you have to cut down on meals delivered, or will it just stay stagnant?
Well, right now we're trying to keep it stagnant, and that's. Yeah, so we're hoping not to have to cut. That's why this ask is so important. So.
Any other questions?
I have one more quick question. What is the percentage of your budget that goes towards delivery?
That's a tough one. Yeah.
Yeah, we can get back to you, but it varies because if we're delivering the meal boxes with 14 or 21 meals, we're able to deliver that on a less frequent basis. We also do deliveries on a weekly basis and on a daily basis. So it really does vary quite a bit. Of course, it's less expensive to do, you know, fewer deliveries, but it's so important to have daily contact with older adults. Our preference would be to somehow be in touch with them every day. So I'm not even sure, we could get back to you with some answers, but it's going to be pretty, you know, it's just one size does not fit all. But I appreciate the question.
Even within my 8-county area, it varies because some people have to deliver much further than other areas. So there's a lot of variables that go into that delivery cost of those meals, whether they need paid drivers, whether they have volunteers to do it. There's not a great formula to give you a quick answer on that one.
Well, if there's no more questions, we really appreciate you being here.
Yeah.
And thank you.